Nursing care plan. In this video, we are going to see the steps of writing a nursing care plan. There are 9 steps in writing a nursing care plan. Step 1, data collection or assessment. Step 2, data analysis and organization. Step 3, formulating your nursing diagnosis. Step 4, setting priorities. Step 5, establishing client goals and desired outcomes. Step 6, selecting nursing interventions. Step 7, providing rationale. Step 8, evaluation. And at last, the step 9, putting it on a paper. Let us see each of these steps one by one. Step 1, data collection or assessment. The first step in writing a nursing care plan is to create a client database. Using assessment techniques and data collection methods, physical assessment, health history, interview, medical records review, and diagnostic studies are the various techniques where the data collection is done. A client database includes all the health information gathered. In this step, the nurse can identify the related or risk factors and defining characteristics that can be used to formulate a nursing diagnosis. Some agencies or nursing schools have specific assessment formats. Step 2. Data analysis and organization. Now that you have the information about the client's health, analyze, cluster, organize the data to formulate your nursing diagnosis, priorities, and desired outcomes. 3 is to formulate your nursing diagnosis. Nursing diagnoses are a uniform way of identifying, focusing on, and dealing with specific client needs and responses to actual and high-risk problems. Actual or potential health problems that can be prevented or resolved by independent nursing interventions are termed as nursing diagnosis. Step 4. Setting priorities. Setting priorities involves establishing a preferential sequence for addressing nursing diagnosis and interventions. In this step, the nurse and the client begin planning which of the identified problems requires attention first. Diagnosis can be ranked and grouped as having a high, medium, and low priority. Life-threatening problems should be given high priority. A nursing diagnosis encompasses Maslow's hierarchy of needs and helps to prioritize and plan care based on patient-centered outcomes. Step 5. Establishing client goals and desired outcomes. After assigning priorities for your nursing diagnosis, the nurse and the client sets goals for each determined priority. Goals or desired outcomes describe what the nurse hopes to achieve by implementing the nursing interventions derived from the client's nursing diagnosis. The goals provide directions for planning interventions, serves as criteria for evaluating client progress, enable the client and the nurse to determine which problems have been resolved, and help motivate the client and nurse by providing a sense of achievement. The next step is to select the nursing interventions. Nursing interventions are activities or actions that a nurse performs to achieve the client goals. Interventions chosen should focus on eliminating or reducing the etiology of the priority nursing problem or diagnosis. As for risk nursing problems, intervention should focus on reducing the client's risk factors. In this step, nursing interventions are identified and written during the planning step of the nursing process. However, they are actually performed during the implementation step. The next step is to provide rationale. Rationales, also known as scientific explanations, explain why the nursing intervention was chosen for the nursing care plan. Rationales do not appear in regular care plans. They are included to assist nursing students in associating the pathophysiological and psychological principles with a selected nursing intervention. Evaluation comes under the step 8. Evaluation is planned, ongoing, purposeful activity in which the client's progress towards achieving goals or desired outcomes is assessed and the effectiveness of the nursing care plan. Evaluation is an essential aspect of the nursing process because the conclusions drawn from this step determine whether the nursing intervention should be terminated, continued, or changed. The last very important step of writing a nursing care plan is putting it on a paper. The client's care plan is documented according to hospital policy and becomes part of the client's permanent medical record, which may be reviewed by the oncoming nurse. Different nursing programs have different care plan formats. Most are designed so that the student systematically proceeds through the interrelated steps of the nursing process, and many use a 5-column format. To know more about the different nursing care formats, please refer to the link given above this video. If the contents of this video are informative and useful, like the video, comment the video, share this with your friends and colleagues. Do not forget to subscribe if you're watching this channel for the first time. Thank you.